Good afternoon, everyone. Thanks for coming out on a dreary, first day of what it feels like fall. My name is Jessica. I'm the administrative coordinator for the Community for Global Health Equity, and I have the pleasure of introducing our guest speaker today. Rachel Daws is a dual Master of Social Work and Master of Public Health degree student at UB, and she received funding from the Community for Global Health Equity to travel to India this past summer to work in partnership with Amrita Unviersity to help implement and evaluate a substance use program in some communities there. And so I don't know enough about that, so I'm going to pass it on to her so she can tell you about it. And please feel free to ask questions and be engaged throughout the discussion. And thanks for coming.
Thank you all for coming today. As Jessica mentioned, I spent my summer studying, partnering with Amrita Unviersity in southern India and working on the Amrita Awareness Ambassadors program to help address substance use in rural villages. So before I start, a big thank you to the University at Buffalo and Amrita Unviersity for the advisors and support that we received, as well as the funding from the Community for Global Health Equity for making this program possible. So just an overview of what I'll be talking about today. I'll start with a little bit about Amrita Unviersity and the international program that I was a part of. What it was like to implement the Amrita Awareness Ambassadors project in India, some areas for further investigation, and some of my own personal reflections. So why India? I chose to do my field placement globally because I'm interested in a career in global community-based programs, and I thought it might be a really good opportunity to get my hands dirty, see what this was like, and if it was something that I actually want to consider doing after I graduate. As a community health and health behavior student with a background in substance use prevention with adolescents, the Amrita Awareness Ambassadors program seemed like a perfect fit. So for those of you who don't know, India is an incredibly diverse country. There's over 29 states with 22 national languages spoken and over 1,500 languages spoken and rural languages spoken. Tobacco is widespread across India, and like in the US, it's the primary preventable cause of death and disease. Additionally, cultural and spiritual practices contribute to substance use, including some ceremonies involving alcohol use, and the belief that certain cannabis use or cannabis-infused beverages can be used for spiritual enlightenment. All this contributes to some of the prevalence of substance use across India. Studies suggest that there's diversity in the prevalence of substances used in rural villages as opposed to cities as well. And Bashir and colleagues in 2013 found higher hospitalizations among rural or tribal village residents due to substance abuse compared to people in urban centers. Studies also suggest that there's a growing prevalence of adolescent substance use in India, with 40 to 60% of students under 18 reporting substance use. However, as I mentioned, in a very diverse country, there haven't really been any comprehensive nationwide estimates of substance use prevalence. So my opportunity with Amrita Unviersity was at their Amritapuri campus in southern India, right down at the tip in Kerala. I also spent some time working in a village on the east side of Kerala in the tea plantation areas. And then we spent the majority of our village visit in a village called Dunda village in Uttarakhand, which was way up north. So a little background about Amrita Unviersity. Amrita was founded by Sri Mata Amritanandamayi Devi, a renowned humanitarian and spiritual leader. It's ranked one of the best research universities in India and has 5 different campuses in 3 states in southern India. And the picture on the right is the building that I had the opportunity to work in. So the architecture there is really beautiful. And I wanted to go through a few of the acronyms and the partnerships with the different programs that I work with because it can be a little confusing. So ACIP, or the Amrita Center for International Programs, is the office at Amrita University that coordinates all activities and housing for international students. And through ACIP, there's a program called Live-In Labs, which provides students both internationally and nationally with opportunities to work and live in rural villages and to partner with a multidisciplinary team to address challenges faced by rural villages. Amrita Create, or the Center for Research in Advanced Technologies for Education, provides technological and digital solutions to expand access to education across India. And Amrita Right, or Rural India Tablet Education, is one of the programs that Amrita Create started to provide education centers and tablet-based education programs. And these education centers are located in 41 villages across 21 states in India. So Amrita Awareness Ambassadors comes in as a branch of the Rural India Tablet Education Program to help address and raise awareness about different health issues, including substance use, child marriage, trafficking, and the plan is to implement this program in those villages where the education centers have been established. So if you're still following me, the Amrita Awareness Ambassadors is a program that aims to prevent children from the harm associated with, as I mentioned, issues such as substance abuse, human trafficking, mobile and internet safety. And they do this by raising awareness about these issues through the training of student ambassadors or peer leaders. And it's a multi-step process, which I'll elaborate on later. And the progress is maintained through long-distance contact with these ambassadors in the village. The goal is that it would be a self-sustaining program, so staff from the university can stay in touch remotely, but the students are the ones really promoting the awareness. So why use a peer-assisted intervention program? Well, studies suggest that interventions that have peer leaders at least playing some role have found lower odds of weekly or monthly smoking and lower initiation of regular smoking, lower odds of alcohol use or cannabis use, and higher self-efficacy to withstand peer pressure compared to control programs or interventions or other interventions that don't include peer leaders. So the aims for me going into this project were first to gain an understanding about the Amrita Awareness Ambassadors Program, which I'll call AAA, and the impact that it has had in the villages where it's been implemented so far. I don't think I mentioned this, but AAA has been implemented in 3 villages already, and 2 of those villages it's been in place for a year. So part of that was to get a sense of what they're doing, what's working, and what might need to be adapted. To then take that information and modify the materials and curriculum to be expanded to another village, Dunda Village. And then going into Dunda Village, our aim was to help raise awareness about the risks and consequences associated with substance use through the training of student ambassadors, and to ultimately develop a protocol for implementation and expansion of this program to those other 41 education centers across India. So just to reorient us, here I was studying in Kochi, near Kochi in Kerala. And the first village I went to was called Kudi. So that was about, it doesn't look that far, but it was about a 6-hour drive. And in Kudi, we started with some informal interviews and conversations with people in the village to get a sense of what they perceive to be the problems, their idea of the prevalence of substance use, and their perceptions about the effect of AAA in their village already. So as you can see in that picture on the top right, for you, I think, we had the opportunity to speak with some of the village elders, and this woman was actually the granddaughter of the man who started the village. So it was really interesting to get those perspectives. A lot of these conversations were over a cup of chai in someone's house. We also were able to follow up with the student ambassadors from this village, and in that picture on the bottom left, we were talking with the female student ambassadors to get their sense of how effective the program was and any suggestions for what we could do better. And they mentioned that they felt that videos and demonstrations were really effective in increasing their awareness, but they also felt that they needed a little more support from our team in order to continue this intervention when we weren't there. So with that in mind, we started modifying, developing resources to take into Dunda Village. And this included translating surveys and resources into Hindi, because as I mentioned, there's a lot of languages spoken in India, and deciding which materials we were going to focus on. So from Kerala, it was a 4-day train ride up to Dunda Village, which if you've never had that experience, I do recommend it. And then it was a 6-hour cab ride from the train station through the Himalayas to our village in Dunda. Beautiful scenery. We started with some baseline data collection after speaking with the principals of the local high schools and locking in dates to begin working with the schools in the village. We did some baseline data collection. We did a general awareness survey for 47 students at an all-female high school that we decided to work with. The students were 13 to 19 years old. And we asked questions about their own substance use prevalence, family substance use, knowledge and attitudes about substances, and their perceptions of peer substance use. We also, the next day, were able to collect data from the student ambassadors that we selected, which I'll explain in a moment. And that consisted of 10 female students between 15 and 17 years old. And again, this survey asked about substance use prevalence, self-esteem, perceived family and school support for their role as an ambassador, and perceptions of peer substance use. So some of the baseline findings, we found that most of the female students had never tried any substances in their lifetime. In this graph, I'll just orient you on the y-axis are the percentages of students who reported use or not using, and on the bottom are the different substances that we asked about. So alcohol included what you would expect, beer, wine, liquor, but also locally made alcohol. Smoking referred to cigarettes or bidis, which is a local tobacco product. Chew included gutka, betel quid, and pan, which they would have been familiar with. Cannabis, we included bang, charas, ganja, and sufa. Some of those are the alcohol-infused beverages I mentioned. And the other category referred to inhalants, opium, heroin, prescription medication that was not prescribed to you, and anything else. So the red bar refers to any substance use in your lifetime, blue is past year, and the yellow is the past 30 days. And only 28% of high school girls reported ever using substances in the last 30 days, which surprised some of my colleagues at the university, because if you know anything about the culture in India, it's much more common for men to use substances than women, and so that number seemed high to them. We also asked about family substance use, and 66% of high school girls reported at least one family member using a substance, and this graph is broken down by family member, and the different colors represent the different substances. So around 45% of girls reported that their fathers used alcohol, and that was the most common substance reported. We also saw some substance use among grandparents. Unfortunately, our item didn't specify between grandmothers or grandfathers. Anecdotally, we assume that it might be more prevalent among grandfathers. So some of the other questions we asked about attitudes towards substance use. Students had a slightly more positive view of alcohol, which told us that this is something that we would want to address in our intervention. Most students said that none of their friends used alcohol, tobacco, or other drugs. And when we asked about peer pressure, most students felt that they could withstand peer pressure, and that they felt most of their peers viewed drinking as a bad idea. Regarding our ambassadors survey, we asked about self-esteem, and the reports of self-esteem among girls in the village were slightly lower than the average for girls in this age group found in other studies. None of the ambassadors reported any substance use in the last year, and most ambassadors felt that they could withstand peer pressure to drink. But this one was interesting. We asked how many people your age do you think have ever tried substance use, and as you can see, 80% of the ambassadors felt that either all or most of their peers had used substances. Nobody reported that no one their age had used substances. So this could suggest that either they are seeing a lot of substance use among their peers, or maybe they're a little misinformed about the prevalence of substance use. So something to look into further. After collecting the data, we then implemented our program. And as I mentioned, it was a 4-step process. So we started with a general awareness or introduction to the whole high school about substance use, and this included some dramatized videos, a discussion following up after the videos, and activities and games. We also, at the end of that general awareness session, we selected 10 students from Dunda Village to be our peer ambassadors, and these students were selected based on some leadership qualities that they demonstrated during this session, and also recommendations by the teachers. Ambassador training included, I think we met with them for a few hours across 5 days to work on peer leadership skills, communication skills, resisting peer pressure, decision making, and then some general knowledge and awareness about substance use and how it affects your body. And at the end of that, the girls were asked to create a skit or a role play, a dance, whatever they preferred, to then disseminate this information to their village. And as you can see in that picture on the bottom, the girls presented their performance at a local primary school to about 40 kindergarten to 5th grade students, followed by a discussion with these students. And then we also went through the village and distributed pamphlets to some of the adults to help get the word out about the program and what they were doing. Since we left Dunda Village, we have had some contact with these students. In August, while I was still there, the ambassadors revised their skit, made it a little more interesting, added some stuff to it, and then performed it at the Amrita Education Center to both parents and students in the village. They also gave their role play to their high school peers. And so through that, we were able to reach 6th to 12th grade students, conduct a pre and post survey with the 6th to 8th grade students, and then share this information with nearly 25 adults in the village as well. I just got an email also that they conducted another a trivia night in their village a few days ago to help increase people's knowledge about substance use in a fun way. So just a reminder, these were the aims of our program. And we felt pretty successful in what we were able to accomplish. So through the preliminary field visit, we gained some insight and direction to modify our program and expand it to Dunda Village. We were able to collect some baseline data on substance use among females in the village, although we didn't have a chance to collect this data from male students, so that's something that the program really wants to address at the next village visit. We were also able to develop and modify some materials, add to the collection of materials for AAA, and develop a template for program expansion in the future. So we created a day-by-day template that future students or faculty can use to expand this program. And as I mentioned, we started some of the follow-up with these students and created a plan for monthly activities for the next 6 months. Some areas to consider in the future. Definitely the university, Amrita University wants to continue to expand the ambassadors program, not necessarily specifically with substance use, but also addressing nutrition and some of the other topics I mentioned earlier. So in order to do this, it's important to collect post-intervention surveys. So we had collected baseline data, but then following up to see was the program effective in raising awareness in Dunda, and also expanding the program in Dunda to male students. In terms of expanding across India, creating templates and materials for various other owners' issues would be needed. And then research and evaluation to assess how effective it is over time, including maybe intervention and a control group comparison, looking at different strategies in different villages and how effective that is. So some of my personal reflections. First, I just want to say thank you again. This was a really incredible opportunity, and I feel like I learned a lot and had a really wonderful time. A few challenges or lessons learned. So I was traveling by myself, which is a really cool experience on the one hand, but also can have its challenges, especially being in a culture where it's not as common for a female to be traveling alone, so just learning how to adapt to that. And then in the US, we tend to have a very direct communication style, which is different in India. So in terms of figuring out what's expected of you or how to accomplish the task that you want to accomplish, took some learning and flexibility to understand what I was supposed to be doing, but it was definitely a learning experience. And one thing I noticed right away is the people I was working with especially tend to walk much slower than we do. They're not in a hurry to get anywhere, and with what I'm used to, at first I was like, why are they walking so slow? But then learning to take things a little slower, to take your time, to enjoy the scenery as you walk around. That's something that I learned. And finally, I'll mention the unexpected consequences of weather. I would just caution anybody who's thinking of going to another country to be prepared to be flexible. So we, being from Buffalo, we think that if it's not snow, it's precipitation, it's not going to hurt you. But this was a picture from the village in the Himalayas, and we had 3 days of pretty heavy rain, which resulted in a lot of landslides. The school was closed for a few days, so we had to learn to adapt what we were doing to accommodate that. And then the highlights. There were a lot of really wonderful experiences that I had. I built a lot of good relationships with the coworkers that I was working with, but also with the students in the village. I think having the opportunity to work in another country gave me a hands-on experience with program development and implementation. I feel like I was able to apply the theories and things that I've learned in the classroom to real-life settings and also see how they fit and how they don't necessarily fit. Understanding and reflecting on if I were to do this sort of thing again, what I might want to do differently. I also had a lot of new cultural experiences. For example, I never knew that in India they don't use silverware, they eat with their hands. So learning how to do that was really pretty cool. I also learned a few words in the 2 languages that I encountered in Hindi and Malayalam. As I mentioned, I learned to walk at a slower pace and to take things in, to be a little more reflective and meditate sometimes. And I also had some cool spiritual opportunities, so being around a lot of people that practice Hinduism, learning about that religion, and staying at an ashram was really cool. We got a chance while we were in the Himalayas to dip in the Ganga River, which if you don't know is kind of sacred. And then just finally being in the village especially was really humbling to see that people work really hard, and they don't have a lot of the things that we have, which you kind of know going into it, but then, just seeing how hard they work, but also how much joy they have in life too. So, thank you for listening. If there are any questions or thoughts about global field placement or what I did specifically.
Was it your decision or the university's decision to strictly work with high schools that were all female?
Can I jump in really quick?
Yes.
If you have a question, please share your name and where you're coming from.
Absolutely. I'm Shaylin McCoy. I'm also doing my master's in public health in community health and health behavior.
Yeah, that's a good question. So, I think we really wanted to work with both males and females. Ideally, I think that was the goal, but the village that we were in, it was a little challenging to work with the boys' high school. We got a little pushback from our colleagues in the village and from the school. So, but the goal definitely is to send a team with more male staff and students to work with those boys in the future. Thanks.
Okay. Hi, Rachel. My name is Beth. I'm an MPH student also in CHHB. My question was just how big was the high school in the village?
I'm trying to remember the exact number. I know there were around, I think it was around 150, 160 students and like 95 9th to 12th graders.
Oh, you're right. Okay. That's a nice slide. Very nice presentation. I'm Rich Shaden from the PhD program in epidemiology. Would you mind going back to the slide where you showed the prevalence of substance use among the girls? So this is like every use of the substance that you listed, right?
Mm-hmm. So yeah, the red line represents every use.
Okay, and this is, and you didn't assess for like, with like other questionnaires that go into more details, kind of like the screening questionnaires for disorder, kind of?
Yeah, we were pretty simple in the survey that we used because just in terms of we weren't sure going into the village what the level of literacy or comprehension was. And so we tried to keep it simple and pretty brief. So the question really just asked, please indicate which substances you have used ever in your lifetime, in the past year, and in the past 30 days. But that is an interesting point. We didn't get a sense of binge drinking or frequent use. One of the things we were looking at really is there a difference in, like, for example, somebody might say that yes, they tried alcohol once in their life, but they haven't tried it in the last 30 days. So that was kind of, gave us a sense of, was it maybe something they experimented with, or is it something they're doing a little more regularly? Thanks.
I have two questions, but I'll ask like one at a time. If you could show the picture where your staff interview the students, I think it's on the slide before.
Oh yeah.
Is it common for you to use like a male staff to interview like the girl? Because I mean that's gonna. I mean I have never done field work in India, but I have a feeling that if you ask something that pertains to social disability, such as substance use, and you get an outsider who's an older person to come and ask a question, there's going to be underreporting.
Yeah, I definitely think that that's a risk. When we gave out the survey to the high school girls in the general awareness, as you can see in that top picture, we had paper surveys.
Okay.
Unfortunately, this is part of being flexible. The room that we were in was very small and very crowded, so who knows if they were looking at each other, talking with each other. When we did the ambassador surveys, we did use an interview format, but we were able to take the girls aside privately. So I think there is a risk that definitely that there's some of that going on. But the rest of our staff were females too, so he was the only male on our team.
The follow-up would be considering like the low prevalence of substance use and possibly even lower kind of like problematic use of substances. Do you feel that the resources in the program could have been better used if you target like the marginalized group in the community rather than like girls with enough resource to access high school education?
Can you explain what you mean by that?
So you have the resource to run the programs in the school, but the school, like, you know, the girls who go to these schools will come from, like, will have enough access to resources, and they're probably not the marginalized group with, like, lack of access to these, like, peer intervention programs. So my question to you is, in your opinion, do you think the program could modify the approach and go into more like the marginalized group in the community, like the Dalit community, if they have it like up there?
So part of, I think, the aim of going into the school is that there is the support of teachers and principals. But the hope is that through the next 6 months of expansion that the students will do activities in their village with peers, with parents, to try and reach everybody, not just the kids in the school. And I think also one of the targets of the intervention is to help improve students' self-esteem too. So I think targeting girls specifically, it was really beneficial to address that self-esteem piece because that is something that we're a little concerned about. But as I mentioned, for future interventions, when the team goes back for a follow-up with this village, they want to try and reach some of those other groups, to target boys, to target kids that maybe aren't in school. But the school that we went to also was, not that it was very under-resourced, but one of the things the principal mentioned when we went in is we don't even have working toilets. Like, what can we get out of this partnership? And we were able to talk with them about sending other teams from the university to help address some of those other issues too. So it is kind of a holistic approach by sending different teams of students to address those needs.
I just want to ask a quick follow-up. Was that a question based on our schools in India primarily private? Is that why you asked? Or was it a public or private school? That's why
I mean, the prevalence of substance use seems pretty low, and I just wonder if it would be like more cost effective to like target the marginalized group in the community that are like at higher risk of, you know, like going out of school is like more the short predictor of going into that, let alone like other risky behaviors. That's my question.
Well, what we do know also is the prevalence of substance use among girls in rural villages in northern India tends to be around 13%. And so this was a little bit higher than those estimates. I don't know, so it might vary by region. And what schools we have access to. I think this was one of maybe 2 schools in the village, so we chose to work with them.
So I had 2 questions as well. I'm Vasi. I'm at the school of I'm actually an environmental engineer. I'm doing my master's in environmental engineering. But so at the school, was it an English medium school? Like, could these children speak English? Or no? Were they taught in
They
English?
were taught in Hindi, and then they
Okay.
took an English class.
Okay,
So
cool.
most of them could say hi, how are you? But everybody else on my team spoke Hindi, so everything was translated into Hindi.
And then the second question, it was the chart showing the family members, like their prevalence of abuse, substance abuse in the family members. So there's a trend that exists with the fathers where like alcohol is like the most prevalent, and then for the brothers, it's actually ganja. Did you expect that trend to persist, or like was that something new? I mean,
I think anecdotally, the rumors that we heard were that the adolescent boys, that there was some ganja use, and as well as alcohol use, but it was interesting to see that really that the alcohol use was highest among fathers, and even if you look at the most common substance used among grandparents, you can see this kind of difference in what is most prevalent generationally.
right.
So yeah, that's a good point.
You made a comment about the fact some of the things you learned were that what you're taught in the classroom and how to translate that in the field. And I wonder if you could touch on that a little bit more. Maybe some lessons that you learned, and then maybe how we might at the university think about structuring classroom lessons in a way that might be more better implemented in the field.
Yeah, one thing that really comes to mind, as I mentioned, I was only in the village for 2 weeks in Dunda village, and we had enough time to implement our program, but I felt like it would have been really great to have a little bit more time to get to know the villagers and maybe get a sense of what do they perceive as the biggest need before assuming that it's alcohol use and this is what we want to address. And that's something that we do talk about in class, especially with trying to empower communities and build that relationship and help, especially marginalized communities and in India, lower caste communities, trying to help empower them to address their own issues. So I think that's something that if time permitted, that we could have done differently. Also looking at a lot of the stuff that I've learned about substance use or addressing behaviors and helping to change perceptions about substance use. Some of those models that we talk about in some of the basic public health classes really came into play. Is that the answer?
Yeah, and I think also on the other end, you mentioned like you had to learn to be flexible,
Mm-hmm.
and so would those types of lessons be important to also teach within the university setting as well, so that students go out, they think they're ready for the career wherever they go, but then avalanches or those types of things happen, and
Definitely.
your plans don't go as planned.
Mm-hmm.
So I'm just wondering, like, is there, from your perspective, might there be some ways of creatively bringing that into classroom teaching at the university level, so that when students leave, they have a bit more of a worldview?
Yeah, I think, and I know some classes do more of a, where you can create a mock program or something like that. I think any opportunity to take the theories that you learned and try and put it into practice, even if it's a simulation. But then also, I think it would be valuable to teach students about like coming up with a plan B and a plan C and a plan D. And I don't know that that's emphasized that much, but yeah, really encouraging students to do that or providing opportunities to do something like that.
So I have a question. I'm Lisa Lanker with CGHU.
I didn't introduce myself.
Yeah. So back to the study itself and the aims of it, the intervention rather than study. Use and abuse seem really tightly linked here, and I'm wondering, is there contemplated within this intervention the possibility that you can use alcohol or use any of the other substances safely and without jeopardizing health, or is it looked at as an automatic pathway to becoming an abuser of the substance?
Yeah, I think the aim of this intervention really was trying to prevent use. And
Any use, like
Yeah, trying to-
investigation of it on the part of the
Right.
person.
And really, not necessarily to say if you ever use, then you're in trouble, but trying to raise awareness about how frequent use can be very harmful to your body, and looking at the health effects, the social effects, how it affects families financially. And some of these kids are seeing that at home. So I think it was really aimed at raising awareness about the consequences of well, really more problematic use, but starting with just avoid it altogether, I think is more of the approach. And also, what was I going to say? Looking at how to build the skills necessary to be able to resist peer pressure, whether that's in terms of substance use or other risky behaviors.
And one other thing, was it in speaking with you that the issue of survey fatigue came up?
Yeah.
You mentioned, so the other day when we were
Yeah.
talking, right? Can you say a little bit to describe what survey fatigue is and how that factored into what you guys did?
Definitely. So that really came up with our preliminary field visit in Kudi. And before we went, there was another team of students from the university who'd been in Kudi village the week prior. And so we were getting some feedback from them about what they observed and what they thought. And the biggest thing that came up, because they had handed out surveys and did surveys with the villagers, was these people know how to take a survey. They know how to answer the questions to give you the response that you want. and they really discouraged us from doing too many more surveys. And I think even while we were in Komali Kudi speaking with some of the elders, they kind of hinted at it, like, are you going to pull out a survey on us? So sometimes I think when you're in different settings, and it can be hard for us with this research mindset of like, we have to have quantitative data or that sort of stuff, but that there is value in just having conversations with people and getting a sense of their perceptions of what's going on.
And then this is another example of being flexible, right? You had your
Yeah,
instruments
definitely.
ready to go, but it suddenly was clear that that would be inappropriate,
Yeah,
right? So,
absolutely.
yeah. Any more questions? If not, well, another round of applause for our